Ever catch yourself clenching your jaw, like when you're really focused or stressed out?
Totally. Or how about
Who
waking
lets
up
know
with a
that?
sore jaw? And you're like, what was I even doing?
Exactly. Like, what did I chew on in my sleep?
Yeah.
Well, get ready to dive into the world of TMD.
Yeah.
That's temporomandibular disorder. We're going to uncover the symptoms, the causes, and most importantly, how you can find some relief.
And you know what? It's more common than you'd think. We're talking about a whopping 60 to 70% of people showing at least some signs of TMD.
60 to 70%. That many people. Okay, so clearly we need to talk about this. So first things first, what are we even talking about when we say TMD?
So TMD, it's not just one thing. It's a whole bunch of issues that can happen with your temporomandibular joint. Think of it like it's the hinge that connects your jawbone to your skull.
Right. Right, makes sense. And it could be like pain in the muscles, problems with the joint itself, or even like, a combo of both.
So more than just your typical jaw ache after a long day of chewing gum. And you mentioned it can pop up in some pretty surprising ways.
Yeah.
What else should we be aware of besides just the jaw pain?
So yeah, jaw pain, trouble chewing, clicking or popping sounds, those are like the classics. But here's the thing, TMD can be kind of a sneaky thing. Like you might get headaches that just won't quit, or earaches that seem to come out of nowhere, even pain going down into your neck and shoulders.
Wait, shoulder pain? Seriously? I never would have guessed that could be related to my jaw. How's that even possible? Well, think about it this way. Everything's connected, right? So when you have all this tension in your jaw muscles, a lot of times because of TMD, it doesn't just stay there. It's like this chain reaction impacting the muscles, the nerves, everything in your head, your neck, and like we said, even your shoulders.
Wow, like a domino effect.
You mentioned stress earlier. Is it really as simple as a stressful day equals a tight jaw, or is there more to the story?
Okay, so get this. There's this whole mind-body connection going on. When you're stressed, your body is releasing all these hormones, things like cortisol. And you know what those do?
What?
They increase your muscle tension. So yeah, that includes your jaw.
Ugh, the irony. Right. But honestly, it's hardly ever just one thing, right? It's usually, like a perfect storm of things. You've got the stress, maybe you're grinding your teeth at night, even an old jaw injury or arthritis can play a role. It all adds up.
So basically, if you picture yourself as a student who's up all night, cramming for an exam, hunched over textbooks, fueled by coffee and anxiety, that's basically a recipe for a tense jaw, isn't it?
Ding, 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 we have a winner. And then you factor in things like clenching or grinding your teeth. Because of that stress, you can see how all these things together make it worse.
Makes total sense.
Yeah.
So let's say someone is listening right now and they're thinking, oh my gosh, this is me. I have these symptoms. What's the next step?
Don't just jump to WebMD. You know you want to.
We've all been there.
Exactly. It's better to see a professional like a doctor or a dentist. They can really figure out what's going on. They'll examine your jaw, talk to you about your medical history. They might even do x-rays just to get a clearer picture of what's happening.
Okay, so no more guessing games. But what happens after you have a diagnosis? Is this something you just have to live with forever?
Actually, there's good news. A lot of the time, TMD can be treated really effectively with what we call conservative treatment.
Conservative treatment, what does that actually mean?
So we're talking about making some lifestyle changes, finding ways to manage that stress, like mindfulness, deep breathing exercises, even over-the-counter pain relievers can make a difference.
Now, you mentioned relaxation techniques earlier. Are there any specific techniques that are particularly helpful for jaw tension?
Oh, absolutely. There's one called progressive muscle relaxation where you're basically tensing and then releasing different muscle groups. That one can be super helpful. And then there's biofeedback, where they use these sensors to help you become more aware of the muscle tension so that you can learn to control it better.
Wow, this has been so insightful. We've covered so much about how common TMD is, all the different ways it can show up, how it's usually not just one thing causing it, and of course the importance of actually seeing a professional to get a proper diagnosis and treatment plan.
Absolutely.
Any final thoughts before we wrap up?
As you start thinking about your stress levels and taking care of your jaw, here's something to consider. Could your sleep position or how much time you spend hunched over your phone actually be making your jaw tension worse without you realizing it? It's crazy how much our everyday habits actually affect us.
Seriously, so much to think about.